Tonight on the Joy Behar Show, sex, sex, sex. Can too much of a good thing be a bad thing? When it comes to an addiction, yes. Dr. Drew Pinsky, addiction specialist, will be joining me along with 2 sex addicts. And after we're done talking, we'll all take a shower and cuddle. Here's a question. Does being a sex addict make a man a bad husband? If he's getting his fix from another woman, I'd say, yeah. Here to discuss sexual addiction is Dr. Drew Pinsky, this generation's Dr. Ruth, except that he's not 4'11", 4'8", really.
Actually, and I bum people's high, too.
Yeah, that's true.
I don't tell them to have a good time.
Yeah, and he's also the star of VH1's Sex Rehab with Dr. Drew, and 2 sex addicts who participate in the VH1 show, British film director Duncan Roy and Playboy playmate Nicole Moraine. Thank you so much for joining us.
Our pleasure.
All right, let's start with, hi, Nicole. You're out there somewhere, but we know you're there.
Thanks.
By the way, I saw your tape with Colin Farrell. Fabulous, fabulous.
Oh,
I
poor
Netflixed
Nicole. Poor Nicole.
Let's talk
I'm
about...
surprised. I can't see you watching that, but that's cool. I guess.
I have my secrets. You know, but is there a difference between a female addict and a male addict? Because the way she describes it, it sounds like more like women who love too much.
Women tend to statistically come to sex addiction through love addiction. So they have these elaborate fantasies. We've all had them. You know, we've all been teenagers, and we normally outgrow them as part of our developmental lives. But some people get stuck in them, and, you know, Romeo and Juliet were love addicts. And by the way, people look at that and they point that out as a reason that romance should be sort of defended. The outcome there wasn't so good. If one of my patients ended up like that, I wouldn't be too happy about it.
Yeah, but listen, Romeo and Juliet is because the families disagree. Didn't you see West Side Story? It's the same thing.
But to make a point, let's finish the point, though. But the fantasy is what becomes paramount. When there's a real relationship, intimacy is disordered, they can't tolerate it, and that's when they cheat and act out sexually.
Also, the myth about
and
sex...
it's hard to...
Wait, hold on, Nicole.
Okay.
The myth about sex addiction is it's about sex. It's not. It's about filling the same void that alcohol or drugs...
Yeah.
You know, and
there's an emptiness.
That's right. So sex addiction is about intrigue. It's about flirtation. I mean, those are just as important as pornography.
How much is danger involved in all of it, too?
Well, for me, a lot.
For you.
a lot of danger. I mean, I was completely obsessed with dangerous sexual encounters with strange guys, usually straight identified guys who would then, you know, the last time I relapsed was in Tompkins Square Park with a cop with a gun in my head.
So it's more about the thrill of the danger.
Well, I
getting
mean,
caught.
no, for me, it's about replicating the trauma, and so
Okay, let's talk about
Do you understand
the trauma.
that? Yeah.
Yes.
Yeah.
I understand you had a trauma as a young child, which is a very serious thing.
Yes.
And
we can laugh about it.
No, I can't laugh about that. No, we'll move on to other things that are funny, but this is not. Because you were basically raped by your stepfather, am I right?
From 2 till 13.
2 years old.
Yeah.
That is not funny.
But you know, the average age of sex abuse against kids is about 2 to 3 years old. That's the average age. So people are abusing infants. That's what happens.
It's unbelievable. We have sort of come through a wave of this that is just unspectacular, and the consequences in adulthood are the replication of the traumas through sexual acting out and compulsively repeating the traumas over and over again by becoming a prostitute, by becoming a stripper, by going for dangerous situations, whatever it might be. People compulsively replicate these
But
things.
do all sex addicts have child abuse in their past?
Not all, but it's very common.
It's very common.
Very common.
Were you sexually abused as a child, Nicole?
I definitely grew up having my boundaries violated, definitely. So
and neglect, too. Nicole, you mentioned abandonment.
Neglect and abandonment and abuse.
Right. I was kicked out at 16 years old, so, you know, I've had to learn survival at such a young age. And before being, you know, and on top of that, having your boundaries violated, that confusion doesn't really help now that, you know, like I'm out there in the world in the streets by myself. It's like, okay, well, what do I do now? How do I handle all of this stuff? Like, what's right, what's wrong? Where do I go find comfort? And what man, and how do I trust that man? And
well said.
So
she puts it
well
succinctly. Duncan, you talk about your addiction on the show. Can we take a look at that clip?
Yeah, when I'm on my own, pornography is very debilitating. I'm talking about getting up in the morning 7 days a week and sitting at my computer all day.
Okay. How much does the internet actually play in all of this?
There's a huge problem with the internet because the internet will take you. Sorry, do you want to do this?
No, I want you to do it. I'll
You're the one who's on the internet.
I'll sprinkle the highlights on top.
I'm the one that's on the internet.
Yeah.
I'm the one. The problem with the internet is that in years gone by, before the internet came, you know, people would find images and they'd be the same kind of images, and if they evolved sexually through into wanting to see other and more dangerous things, it would be very hard for them. Now you're only 3 clicks away from something that would land you in prison. And that's a huge, you know, that's when we're talking about unmanageability and powerlessness.
You got to remember, it's really changed the landscape.
Yeah.
Having this portal on everyone's desk is like having a crack pipe for the sex addict on their desk all the time.
Really? Okay. And let me ask Nicole, how bad did your addiction get, Nicole? I understand that you were into masturbation a lot. But that's
Right.
Isn't that from anxiety, all that masturbating? It's from anxiety.
Well, it's a way of managing feelings.
You know what? I really try hard not to think about masturbating too much. I had a moment there where I really could not get out of bed one day because it was a constant thing, and that was an exhausting day. It was like I didn't even want to eat food because that was my food for the day. It was exhausting and it was scary because it consumed my entire day, and I try very hard to not have any triggers around, you know, around me where I would feel like I need to masturbate today because I'm fearful of not getting out of bed for the day. But
okay.
You know, I'm definitely a lot better. I'm definitely better. I'm still human, don't get me wrong. I mean, we all have to clean the pipes.
And a masturbation like that is an addiction. It's an addiction. I mean, if you stopped eating, it could.
Yeah, sure.
It could cure your addiction to food. Think about it that way.
Yeah.
Now, you had some childhood trauma, right? Mm-hmm. What happened?
You know, like certain family members just, you know, just touch you inappropriately and things that I know were wrong, but you know what I mean? Like, for me, it's like, well, I don't know how you talk about this stuff.
Sure, of course. I'm sure you were threatened, too, by some of these people, right? You didn't deserve that, did you?
Right.
Okay, that was a clip from the VH1 show, Sex Rehab with Dr. Drew. Dr. Drew, okay, let me ask you, how do you treat sexual addiction? What do you do?
It's different than other addictions in that it's so deeply embedded in who the person is. It's also deeply embedded in trauma, as we've talked about. The big difference for me was that you leap very quickly into very heavy landscape. Very deep issues come up very quickly and are done in an evocative fashion. Lots of education in sex rehab. Drug addicts won't sit through the kind of education that sex rehab candidates sort of gobble up. It's really interesting. When you have the appropriate candidate at the appropriate level of care, they really respond well to it. And so a sex rehab treatment center has got to have patients that can tolerate evocation, a lot of intense feelings,
yes,
and can sit through lectures and learn about things, and really has to be willing to change with stuff that's subtle and deeply embedded in who they are.
So you can't have ADD at the same time.
It's difficult, but some people do, yeah.
Because you'd been working with
chemical addicts.
Chemical addicts for a long time, so you were really surprised by the way we responded.
Well, we put together this great team, and I sort of inserted myself into the team, and the way these guys, first of all, their courage was just spectacular, and then secondly, the way they leapt into the process was something new for me compared to what drug addicts do, who resist the process, or if they leap in, they use it as a reason to go do drugs.
But sex addiction is harder, you say?
It's harder.
It's harder
more
to
tender,
cure.
It's more painful.
Well, I've been
it takes
sober
longer.
like 13 years by the time I hit this
Chemical
wall.
Chemical sober.
So chemical
and it's
sober
sobriety.
from what?
I've been sober from drugs and alcohol for 13
years.
And then, about 8 months before I did the show, I really hit this wall in my sobriety where I realized that I transferred all of my addictions into sex and internet and all the other stuff that I was doing.
That's an interesting point to me. The people who are addicted to one thing, they give that up, and then they pick up another addiction.
They can, yes, they can. It's again, addiction is a motivational disturbance in the deep recesses of the brain where there's no logic, no reason, no language, just a motivational disturbance.
Yes, so now you gave up booze and drugs.
Yeah.
And you've been rehabilitated as a sex addict, right, Duncan?
Well, you remember,
Almost.
there's no cure for addiction. It's a progressive condition which can be arrested. So all I have to do on a daily basis is arrest my condition. I mean, that's really all I can do.
And Nicole was saying that, that sex addiction is so deeply emotional, which is very much that point. It's so much of an emotional process. Yes, Nicole?
Because there's so much trauma, too. Like,
Right,
you know, that's the difference between being the sex addict and dealing with the abandonment and intimacy issues, which is way more traumatizing, and you're dealing with a lot more emotions. So
it's very interesting how some addicts become very religious, I notice. They become extremely... George Bush was an alcoholic, and then he became very, very religious, and it was all about the Lord. It's like another addiction in a certain way.
Addicts are prone to extremes. They really are. But religiosity and all, I don't see that much. You'd be surprised. I mean, yes, I agree with that case, but I don't see that much of that.
George Bush would have appreciated a 12-step program, I'm sure.
He should have gone through it.
Guy. He would have been a better guy.
He never went through any of it, I don't think.
I'm sure.
Now, on your show, you have 8 good-looking sex addicts living together. Now, isn't that a recipe for disaster?
No, but this is well, maybe in the Joy Behar Sex Rehab program, but in mine, it's a professional environment. It's just like we keep a bunch of drug addicts together. I mean, yes, drug addicts do drugs. They do them together.
Yeah, but drug addicts is different because there's no drugs around, but people are there, good-looking people.
Yeah, but we really wanted it. I mean, that's the difference.
You really wanted what?
I really wanted sobriety and sexual sobriety, and a lot of those people were desperate. Like my friend Jenny, all of those people had come to the end of the road. You know, of course there was flirtation, and of course there were kind of the immediate kind of like, oh yeah, that's cute, or this is cute. But the point is that you wanted sobriety more than you wanted to get laid again.
And we helped them with that. We had them dress a certain way. They were not allowed to touch each other. We were on them constantly.
What about it during the night? Come on.
First of all,
nothing.
No, it's impossible.
We were in bed by 10.
We were on them. We have nursing staff on them. We watch we're just the way we're watching for drugs and alcohol coming into a unit, we watch for sexual improprieties. The only thing we cannot monitor was masturbation. We trusted them to tell us if they had a slip there, and they did tell us when that happened.
Once.
Nicole, did you confess about that? Nicole?
No, I didn't.
I
made it through.
She made it through. Well, good for you. Good for you. But they're all gorgeous people. Are there any ugly sex addicts that you treat, Dr. Bernstein? I mean, are all of them so gorgeous?
I don't cast these shows. I try to get involved at all because for me, if I come upon somebody and they need treatment, I can't say, hey, wait till the cameras heat up in a couple months. I have to treat them. So I just stay out of that part as much as I can.
Okay, and there are more women than men, which I had a question about that because I think that mostly sex addicts are male. Am I wrong?
I think explicitly sex addicts, but boy, there's a lot of love addicts out there that are women that are flirting with sexual addiction.
The women get a romantic spin. You notice that? They're love addicts. The men are sex addicts.
Well, I think the problem is
I know, but you know what? It's funny. I wish there was almost a different name for love addict because it does sound so like, oh,
well, it's
so
codependency,
sweet and
sort of, isn't it?
But I mean,
it is.
It's such a deeper issue when you're dealing with abandonment and intimacy issues. Like, I didn't know that there was a difference between sex and love. I thought they were the same thing. Until I did the show. I didn't know that.
A lot of people make that mistake. You're not alone in that.
It's true, but that's how people get into trouble, right there. But listen, we live in a time when this country, we have destroyed intimacy. We just have. And the substitute for that are all these arousing activities and extreme sports and intensity and power and control. That is not intimacy. We've lost track of that. Our families have been disrupted for a long time, and so we don't have good models for intimacy. And sex becomes the surrogate, or fantasy becomes the surrogate, and that's what Nicole's talking about.
Are you both?
And my relationships. That's what I dealt with. I live most of my relationships in intensity rather than intimacy.
Are you both abstinent now? Because you can tour with Sarah Palin if you...
I think the thing about it is, this is something people get very confused about with sex addiction, is that you have to define your own bottom line. You know, for me, I'm not allowed to jerk off compulsively. I'm not allowed to masturbate compulsively. I'm not allowed to look at internet porn. I'm not allowed to look at hookup sites. I'm not allowed to... But actually, I am allowed to have sex with consenting adults, because I wasn't.
And the danger thing, you don't feel that anymore?
Well, that's absolutely my bottom line behavior. That's what this thing that is absolutely the worst thing that I
That's
can
a
do.
tough one. I have questions from people who tweeted and Twittered and all that. So let me read a couple of them. Well, we went through this. What are the differences between male and female? We would know that one is love and one is sex, sort of.
They end up in the same place very often, and it's the roads there that tend to be different.
This is from Eve Behar. Do you think the way we Americans view sex has something to do with the problem of sexual addiction?
I don't. People make a big deal about that, about we're so prudish and puritanical. I don't see that. I see nothing but sex everywhere in this country. You come from another country. Do you see us as being affected
You're
by
from
that?
England, I take
Yeah, I'm
it.
from England. So I don't see you as being prudish, but I do see you as having very strict ideas about what's, you know, the whole gay straight thing. Now, for me, that's so American, you know, because I think people have a lot more sexual fluidity in Europe than they do here.
Oh, you think
know,
so?
a lot
Yeah.
of my male friends have had encounters with other men, but here they'd be, oh, he's in the closet, or he's in denial. And, you know, there, it's just like, okay, well, I tried it, it wasn't for me, that's fine, let's move on.
That's why people say, oh, all the Brits are gay.
Yeah, exactly, that's right.
Now we know why.
But strangely enough, most straight men will encourage women to, like, maybe perform for them, you know, two women in the bed. That's like a big straight fantasy, apparently. So, I mean, you know, what does that mean for most women? That they're really closeted lesbians? I don't think so.
Oh, it's different for women.
Oh, why? Because they couldn't get hard.
I don't know. I don't know. But, you know, explain to me, like, you know, when we talk about pedophilia or exhibitionism, those are, like, really in another category of sexual addictions, are they not?
They can be another category, or they could also be part of sexual addiction. But there are things that can be treated oftentimes, and that's one of the things.
Pedophilia, I think, has they have a lot of trouble treating
very
those
difficult.
people.
One of the things we tell patients is, please get help before you hurt somebody else or yourself. Because those roads you go down.
How about medication? Does that work at all?
Medicine has a role to be played, but really only in certain diagnostic situations. It's not particularly a treatment for sexual addiction per se.
Okay, let me do another one before we go. Jana was married to a sex addict for 20 years, she writes. He needed more than just having sex with me. He needed the danger, like you were saying, the threat of being caught, and even the possibility of dying during sex.
Well, Duncan said that's him too, but here's the deal.
Of dying. Did you ever feel that?
I felt like I was trying to replicate what I was doing when I was a kid. When you are being raped when you're 4 years old, you are kind of dying. Do you know what I mean? You don't know when it's going to end. The pain is overwhelming. You think, like, you know, you're being questioned, you know, being challenged in so many different ways. So finding that as an adult often takes you into very, very terrible places.
Let me get a last word from Nicole.
sorry.
Nicole, are you? Do you feel like you're almost over this? Where are you in all this?
I'm in Los Angeles right now.
No, I mean, where are you emotionally?
Oh.
That might have said it. I'm not sure.
Yeah, you're right.
I'm so glad I dyed my hair back brown. Where am I recovery?
Yes.
Believe it or not, I feel really good about my recovery right now. I actually haven't even had sex in like over a month, and that's
Good
just
for
by
you.
choice.
She's better.
And yeah, I'm single. I'm single and I'm dating, but I'm just kind of taking my time
Nicole.
as opposed
Thank
to...
you all.
Okay.
Nicole, Duncan, thanks for joining us.